This conference will now be recorded.
Hello, and we welcome you to Coffee with Nahara. My name is Janet Borland. I'm the Association Director for the National Native American Human Resources Association. In today's presentation, Nahara proudly presents Newport Healthcare. The title today is Empowering Families, a Roadmap to Family Engagement Therapy in a Mental Health Crisis. This presentation today focuses on the most important valuable relationships and resources a young person has, their parents and or caregivers. It will discuss why emotionally supportive parent caregivers relationships are critical when it comes to communicating with those struggling in mental health challenges. This presentation today will also provide you the opportunities to learn about more of the attached-based family therapy and offer a space for professional and families to reflect on their own experience and explore skills and strategies to utilize with loved ones to deepen the relationship and attachment. This information is important for you as an employer, a human resources professional, an insurance provider, and especially as a parent and caregiver. Whether strong or strained, family relationships remain paramount when conceptualizing and treating mental health, especially in the adolescent years. This presentation aims to prioritize family engagement in adolescent care, discuss challenges to this dynamic, and provide skills for the integrating family system. I'm so excited to present our presenter for today, and it's Samantha Quino. She is a licensed marriage and family therapist who has been working with the family system perspective throughout her career. Currently, Samantha is the National Director of Family Therapy Services for the Newport Healthcare. She oversees all family programming throughout residential and outpatient sites. Newport utilizes attachment-based family therapy to provide support to families throughout the treatment process. Samantha has an extensive experience with working with adolescents and adults who have experienced trauma, including sexual and physical abuse. She's also an expert working and has expertise with the LGBTQ plus community and issues related to gender and sexuality. Samantha is an established conference speaker and has been featured in the news and media outlets, including CBS Evening News, Yahoo, Life, and Hola USA. We're so excited to have you, Samantha, to talk to us about um, this presentation today. And for those who have joined us today, if you are THRP certified, we will we will notify Barb Griffin to let her know that you attended today's session and received your THRP credits. With that being said, I introduce to you Samantha.
Wonderful. Thank you so much for that introduction. And I'm so glad to be here with you today to talk about a topic that is truly really near and dear to my heart. As part of the introduction shared, I'm Samantha Quino. I'm a licensed marriage and family therapist, and I've had the privilege of working with Newport Healthcare for the past 8 years. And as a family therapist, I really want to stress to everyone on this call that we all have a part in this process. And so I hope that you take from this presentation really an opportunity for you to reflect on yourselves, an opportunity for you to learn how to engage with loved ones that are struggling, your coworkers, your colleagues who are looking to you for support, and how to really navigate this process, because truly we are a community and we really want to make sure that we all have different skills and tools and resources to support those of us that may be struggling or have a loved one that is really struggling. And part of this is something that we see and we feel all day, every day. We see it in the news, we see it on social media. We certainly know that our teens and our adolescents and young adults are inundated with messages, and we see that they are struggling. We know that our adolescents and young adults are struggling with sadness, hopelessness. We all see that in day-to-day life, the increased rates of depression, anxiety, suicidal ideation. And so I really want to just be honest about where our world is right now. I think we all feel it. particularly in even a post-COVID world. There's been so much change and so much stress that has gone on, and our teens and adolescents are truly feeling it the most. So I want to just take a moment to identify that we see it, we feel it, and then what happens next? I mentioned just a few seconds ago that I'm a family therapist and I look at the whole system. And I think we all know when we see these really stressful times in history, where we see moments of tragedy or chaos, the first questions that are typically asked when it is an adolescent or young adult or young person that's struggling is, where were the parents? Did they know what is going on in that home? Did they have any idea that their loved one was struggling or stressed or worried, right? There's so much that goes back to the root of why is this person the way they are? How are they feeling this? Was the struggle seen? And so a lot of what we're going to be talking about today is really giving credit to that question, because we all struggle with it, right? When things happen, we say, why? Part of this is going to speak to that question and really appeal to that when there is struggle, there can also be strength. So please just keep in mind that while we may be talking about some difficult topics, I am in the business of helping people and reinstilling hope. And I believe that everybody listening to this presentation also is approaching this with hope as well. When we're thinking about the parents, when we're thinking about the why, when we're thinking about, do parents know, do parents matter, do caregivers, loved ones in community matter? The answer is implicitly yes. And that is because of attachment. Right? This is probably something you've heard before, and we'll go over a number of elements regarding attachment. But I want to share with you a little bit about the attachment theory, that there is this really evolutionary component to humans. We are relational beings. We are meant to be in connection with others because that connection matters. And so Bowlby's attachment theory really indicates that parents, when they are available and responsive and attuned to their child's needs, it makes a difference. And so we want to kind of reinstill this belief that attachment matters. And again, there will be a theme here that's going on. This is not about blame, right? This is not about blame or shame in any capacity. This is really about shared accountability, because if we isolate someone that's struggling, then it's all on them to heal. So attachment theory and everything that we're going to be talking about today is, again, that sense of community, that we pull our strength from others, that we can use them as resources, and particularly for children, for adolescents, for young adults who are still deeply in connection with their parent or caregiver, that expectation is so paramount for the parent, right? That connection, that attachment, that it really can indicate future relationships and really becomes the base, right? The foundation for which a young person takes up space in the world. So when we're thinking about this attachment theory and what is important to consider when we're looking at attachment in general, it's acknowledging those peaks and valleys of connection, right? It's acknowledging that attachment can be stressed. Life happens, right? Life can be super stressful and super overwhelming for everybody in the family system. Right? And particularly when adolescents and young adults are struggling, we really want to be thoughtful of how it impacts the emotional health functioning for our adolescents and young adults, right? So this can certainly impact their willingness and their ability to communicate their feelings. It can certainly impact their emotional regulation, right? I think we know teens get a really bad rap for their emotional dysregulation. Parents have their role in that as well. And so because they're learning these patterns, right, they're developing different skills, and potentially if they do not have a strong attachment to their caregiver, it can lead to developing maladaptive coping skills, which we'll get to in just a few minutes. But really, when there is that risk of attachment, or what we'll talk about as insecure attachment in just a moment here, adolescents and young adults really don't trust things around them, and that willingness to be vulnerable, right? In order to grow, in order to learn, we have to admit our mistakes. And vulnerability, when there's not secure attachment, can be really scary and really overwhelming. And so this can lead an adolescent or young adult really into internalizing those feelings. Right? So that's part of the component when we want to think about how attachment really impacts emotional functioning for adolescents and young adults. The other side of that is, how does family engagement really encourage healing? How does it encourage that accountability? So many times I think we think that, again, someone's in struggle, that they're just in their own moment, that they are experiencing their stress in a vacuum. It's sometimes easy to have that identified patient, and it can also be really hopeless. If we widen that scope, if we consider the family factors, if we consider that relationships and parenting matter, again, it gives us that opportunity to have a higher chance of success. Right? We know that there are history and genetic components to struggles or to anxiety, depression, mental health issues, substance use issues. So we want to be considerate of that fact. And if we have family that's engaging in healing, that's willing to take some of that accountability, it really can make the most out of being able to have further change, right? We want that positive change. We want to instill hope because it leads to better outcomes. In family therapy, right, we don't want to just change one wheel on the car. We want all wheels to get assessed and all wheels to be strong so that they have that longevity for healing when things come up in the future as well. This is something that you may also have heard or are familiar with, and I just want to spend a moment on thinking about attachment styles, right? Because you've heard me now talk a little bit about secure attachment and insecure attachment. So secure attachment is really what we want to reinvigorate in families that are struggling, right? We want the parents and caregivers to be available, to be responsible, to be really aware of the things that our adolescents or children are going through. And I just want to briefly say, sometimes parents get really caught up in what should I be asking? What are the questions? I'll just share with you that the questions are not nearly as important as listening to the answers that are provided, right? So how do we reinforce the worth of our children? It's by listening, and we'll get to that, right? But all of this is about that secure attachment, whereas an insecure attachment, which is typically categorized through anxious, avoidant, or disorganized, is really about that disconnection between a parent and a child. It's a disruption in that safety. It's really showing that the adolescent or that young adult, maybe that their worth can be impacted. And again, this is not necessarily conscious from the parents, but they're interpreting this, that no one is going to understand them, and that can create a lack of trust for adolescents. And as we go through and talk about attachment and talk about attachment-based family therapy, these are really some of the themes that I want you to be thinking about. When we're considering insecure attachment, right, when we're talking about when adolescents are struggling. So part of this is, we're thinking about mental health struggles or disordered eating, substance use, social isolation, school avoidance, any of those struggles really as symptoms. Really thinking about that as the symptom of chaos that's going on for the adolescent, for the young adult, that insecure attachment matters, that we don't want to get caught up just in the behaviors. We want to be thinking about the connection and the attachment that this person who's struggling has with their caregiver and with their parents. Because we know that the impact, again, of that insecure attachment can show up in a whole host of different ways. Right? The way that they relate to others. I mentioned before that feeling deeply misunderstood, right? I'm sure those of you who know any teen who's going through their way in the world has heard them be like, well, nobody understands me. No one understands what I'm going through. And part of this is, how do we reinvigorate the connection, right? On the other side of things, when we're thinking about insecure attachment, like I just mentioned a moment ago, life happens. Parents I believe, are truly doing the best they can with the resources they have. And there are a number of components for families to consider that can impact that insecure attachment, right? If families are in high conflict, if they are going through their own parental stress, if they are working on their co-parenting, or if they have multiple children, or if there's job insecurity or financial considerations, right? There's obviously really significant issues that are going on in a family system, and kids feel that. right? Everyone, again, we're a family system. Everyone feels that. We're not living siloed when everyone is under the same roof. So I really want to be thinking about some of those components. Obviously, other factors of insecure attachment may be really traumatic experiences, or a child's psychopathology of themselves, their own mental illness. Maybe they have learning disorders, right? Those are the things that are the undercurrent that can really inform insecure attachment through chaos. So what we're talking about, right? We just talked a little bit about attachment, connection, the reason we want families to be involved. And the other piece of that I mentioned before was accountability. So what we're going to be spending a great deal of time on is attachment ruptures, right? So that there were disconnections, there were missed opportunities of connection between a young adult, an adolescent, a child, and their parent and their caregiver. There were moments of missed opportunity when that child went to their caregiver for an emotional need that was not met. And what does the child learn when that emotionally, then that caregiver is not someone I can go to, right? And that's where potentially some mental health struggles will start to show up, that anxiety, that depression, elements like that. The adolescents that we see in residential care and in outpatient care at Newport Healthcare often are really struggling with that reactivity, the inability to manage their emotions, that they're struggling with that anxiety, depression, self-harm. That's what they're coming to us. And those can last a lifetime if we really don't get to a place where we can search for those attachment ruptures and heal the wounds that have then led into some of those negative core beliefs that an adolescent has about themselves. So here's the piece, right? You're probably thinking, Sam, you mentioned a few minutes ago, this is not about blame or shame, but we're talking about how a parent's interactions and connection with their loved one or with their young person in their lives can impact their mental health. That's the system we live in. But the piece that's so important here to remember is that all of us, that everyone has a different sense of internal resiliency, right? So why when, two people are getting a car accident and one person can get in a car the next day, no problem. And another person can't get in the car for weeks, months, maybe years. It's because of their own internal resiliency and their core beliefs about themselves. Right? There is something that has gone on for that child, for that adolescent, for that young adult that's struggling, that their self-worth, their internal resiliency, their core beliefs about themselves really take space as their disempowering beliefs, right? That they don't have this ability to recognize the positive in themselves. And so it becomes this really root of how they see the world, right? That becomes their worldview. And so when we think about attachment ruptures with loved ones, those are then just highlighting those negative core beliefs that they have about themselves, right? As you can kind of see here, even on this tree, that's how they all branch together. And so part of this is, can we rebuild the foundation? Can we get down to root causes? Can we address head-on attachment ruptures so that the adolescent is able to connect with their parents, connect with their caregivers, and feel reinvigorated to use them as a resource, to feel emotionally safe to be able to do that? So now we're going to move on to the modality that we use called attachment-based family therapy. And what's really wonderful about ABFT, a number of things, but really is that this does create accountability for all family members. So many of the adolescents that we see are so used to feeling like I'm the problem. This is all about me. But family therapy, I like to say, is equal opportunity hot seat, that everybody is held accountable. And attachment-based family therapy gives us, as evidence, empirically supported, a structure in which to make sure that all family members are actively engaged. So I'm going to be spending, the next part of our presentation really walking you through this modality, its efficacy, and the way in which it tends to the attachment ruptures, how it tunes in to the parents and caregivers and to the adolescent and young adult that's going through treatment with them. I do want to highlight just briefly the 4 models that ABFT integrates, in particular emotionally focused therapy. So what this means is that emotions are going to take up space, right? We don't want to just pay attention to the behaviors, right? ABFT really is about getting under the root of the wounds. And so that means going for the emotions. So throughout every step of this process, the emotional attunement, right? The matched affect, really making sure that when our clinicians are working with the families, that they're able to feel emotionally safe, that they're opening up when they're talking about sad things, that they're expressing that sadness, right? So again, we'll talk about that in a few, as we go through the model, but I really want to stress the importance of emotionally focused therapy because we're showing up, right? We're really making sure that our families, that our therapists that are providing family therapy are taking up space in the room, right? So ABFT, what's really lovely about this is that it can be individualized for the family that we're working with. It can allow the therapist that is providing the therapy to take up space in the room, right? Insights change, and ABFT really allows the clinician to share those insights with the family to make sure that we're supporting them in chaos. I mean, particularly if we have a family that's coming to, a residential level of care, if they're coming to weekly family therapy, they know that they're in crisis, right? They know that they need help. And so we really want to make sure that we are giving them organized goals in which to work towards, and that we are underscoring the importance of that family component. So again, I mentioned before that ABFT is all about the attachment ruptures. It's not about the symptoms or the behavior or because we see those again as the symptoms that are coming up. I will say this can be a little bit challenging for families because they just want to get to fixing that. The belief of ABFT is that if we get to the root, all of the other symptomology again will dissipate. So we're moving that from that behavioral focus to the emotion focus, right? I mentioned that EFT, the emotionally focused therapy, just a few minutes ago. That will be strung through all of this. The other thing is that this gives a real in vivo opportunity for families to use new skills. Right? So ABFT really allows the family to have concrete moments of healing, of change, to be able to work on their emotional safety with one another as well. ABFT is broken up into 5 tasks. So we're looking at the relational reframe, the adolescent alliance, the parent alliance, repairing attachment ruptures, and promoting autonomy. We're going to be spending the next part of our presentation talking about these 5 tasks in detail, but I obviously want to kind of give you this guide for how it looks, right? We have this framework, and as I just mentioned before, the family therapist is really going to be working with the family to assess how they're moving through, and we'll talk also about the flexibility of ABFT as well. So the relational reframe, this is the first session. So this is a typical, 45, 50, 60-minute session. And this is the opportunity for the family to really set the stage, right? This is the first session that we hold all family members accountable to say, okay, tell me about your family, right? Tell me about some of the strengths. So many times the families that we are coming into family therapy are feeling hopeless. They're feeling helpless. They're feeling confused. They're feeling overwhelmed. And right, they're really, really good at fighting with one another. In this moment of ABFT, we want to remind them, what are they fighting for? That's why we're going to explore their strengths, right? We want to understand, and this can be something that maybe was years ago, right? Or maybe they share the same sense of humor, or they all really love, a favorite birthday tradition, or they have little nuances that are in their family, that those are those strengths, right? So we want to highlight those strengths so that we can, again, remind the family that there is love in their foundation. Right? We just have to figure out how that creates emotional safety and how to repair those attachment ruptures. The other component to the task 1 is understanding the client's mental health. So typically when a family is coming into treatment, again, at any level of care, there was a catalyst for that event. So we want to be able to talk about that as a family. We want to share, what is that perspective, right? Like, how did we get to this point of feeling so, the adolescent or young adult is feeling so depressed, or is thinking about, having suicidal ideation or self-harm, really exploring what that mental health concern is, right? And then the, real important, piece de resistance of the task one is directly asking the adolescent why they don't go to their parent for support, right? Clearly just asking, okay, so you talked about these strengths, and now you're saying that you've been struggling with suicidality or self-harm, or you have been isolating or feeling so depressed. Why don't you go to your mom or your dad when you're feeling sad, right? So we really want to highlight why that is. What we're looking for in that moment is for the adolescent or young adult to name that attachment rupture. Well, I don't go to my dad because I'm worried that he's going to judge me. Or if I tell my mom how depressed I'm feeling, she's going to say, she's going to start crying and say that she's depressed herself. Right? Like, we really want to understand, why don't you go to your caregiver when you're struggling? Now, I will say one of the most challenging aspects of task one, when the adolescent or young adult does share that attachment rupture, we don't go into it, right? Typically the family members are like, okay, we have some, my child just told me that they think I'll get mad, or they think I'll get emotional. I want to express that I'm not going to do that, or I want to apologize. This is not that moment. Even for the therapist, this is not that moment. We just want to put it all on the table, right? We want to make sure that everyone is clear of the attachment rupture that's there, and then really be able to amplify that emotion to say, okay, now we know what's taking up space in your family. We now know why your loved one is not coming to you. Are we all ready to work on this together, right? Are we all ready to really contract to work on this connection with one another? So again, this is task one. This is just a first session, and we really want to get the engagement. Now, I want to just briefly say, it doesn't have to be like resounding excitement, right? Like, family therapy can be really overwhelming. And so we really want to make sure that the family has just the willingness and curiosity. Task two is the Adolescent Alliance. This is when the therapist is meeting individually with the adolescent. Now, what I really love about ABFT, and task two in particular, is that we're getting the reasons, right? So many, like, or we're getting the examples. So many of us want to say, like, well, you said that I was, I'd get mad, or you said that I was going to be emotional. Can you give me an example? When has that happened? So really, in task two, we're meeting with the adolescent, we're connecting with them. We want to know about how they view their family, how they view their friends, how they view their space in their social connections. And then we want to explore those attachment ruptures, those concrete examples. So that is a really empowering moment, that we literally want the adolescent to be able to come up with a list and to identify those moments of disconnection or disappointment. We want them to say, well, my dad called me a loser when I told him I wanted to quit soccer. Or, my mom told me it would deeply upset her if I dropped AP Spanish, right? Like, whatever it is, there are those moments of those episodic memories that a client, that a child, an adolescent is going to have, that we want to bring up. Now, I do want to remind you quickly about EFT, because when we have an adolescent talking about these moments, talking about these attachment ruptures, we really want that emotionally focused work to come up. Chances are, particularly if you're working with an older adolescent or young adult, they are going to really rationalize it. Like, oh, well, it's not a big deal, or it didn't matter that he called me a loser, but he did. We really want to get to the root of that emotion, and we want to be able to help them to find voice, right? Because all of this is going to be the adolescent coming up with these concrete attachment ruptures and sharing them with their parent, right? So this is separate, right? This is just the adolescent and the therapist preparing for a later task. So we want to help them explore those attachment ruptures, highlight the impact of that they deserve that love and support, and it's okay to voice that maybe their parents haven't shown up for them. in a thoughtful way, while also making sure that they have some of their own emotional regulation skills, right? This is not just an opportunity for an adolescent to go in and say, oh, well, you did this, that, and the other thing. No, we want to be able for the adolescent to approach their loved ones with care and consideration. Simultaneously to task 2, we also have to prepare the parents. Now, I will say this is where a lot of heavy lifting comes in, because if you're in family therapy, an adolescent is struggling, the parents are thinking, well, it's just them, right? Like, let's just make sure that they're okay. But they're not alone in this process, right? That goes to everything we've been talking about prior in this presentation. So we want to meet alone with the parents to understand how they are, who they are. We want to know what they've experienced. How, are they trying to parent just like their mom or just like their dad or the opposite of their uncle, right? We really want to make sure that we're understanding the context of their parenting. I mentioned before those stressors. Are they coupled? Are they uncoupled? Are there marital issues? Are they a single parent? Are there financial considerations? Do they have other kids and maybe some siblings are struggling with mental health or disability of their own? Right? So we certainly want to be really thoughtful because we want the parent to feel seen. The other thing is we want to access that emotional vulnerability for parents. We want them to be able to model a willingness to grow and to change. Again, so many families or so many adolescents and teens kind of feel like, well, I'm on my own. My parents are never going to change. I don't know about this family therapy thing. But this is really where we are holding parents accountable to that we want to activate that caregiver instinct, right? To relate to, gosh, your child's obviously struggling. Have you ever had a time in your life that you've struggled? Or can you think of examples that you had a need and your parent was not able to meet that, right? We really want to connect the emotions that we figured out in task 2 to task 3, right? We really want to prepare the parents to be able to sit with that emotion. The other part of task 3 is giving them emotion coaching skills, right? We want the parent to be able to engage in difficult conversations in a really different way. We want them to approach conversation with curiosity rather than criticism. Right? So we really want parents to be able to have their do-over. Because remember, in task 2, we came up with all these concrete examples. We're going to bring those into task 4, and we want the parents to be able to show up differently. So we're understanding the context of parents and then giving them new skills in which to engage and relate to their child's experience. Now, task 4, this is what all the prep has been for, right? So task 1, 2, and 3. Task 4 is really about having that opportunity to repair those attachment ruptures, those concrete episodic memories that the adolescent came up with. They're now bringing them to session, right? So I will say this. If everybody has kind of learned and got some insight into themselves in task 2 and 3, in task 4, the family will be able to have a very thoughtful conversation about this, and maybe the therapist isn't going to be as active, right? But it'll really depend on how the family shows up. So for that example we were talking about before, when we have the adolescent say, well, I felt, I felt like or you told me I was a loser if I was going to quit soccer, right? The piece here is that the goal is not apology, because apology tends to shut down conversation, right? If the parent responds with, oh, well, I'm sorry, I never meant to say that, a knee-jerk reaction is often like, oh, it's okay, and then it closes conversation. This is about accountability, right? This is for the parent to use those emotion coaching skills and to say, I can hear that you were feeling really hurt. My intention would never be to hurt you. Can you tell me more about why you wanted to quit soccer that I didn't understand? Right? So we really want the adolescent to be able to express those emotions. We want the parents to validate, to be curious, to really show that they're able to have difficult conversations without escalating themselves, right? And so this task 4, you see the cycle here, this will take as long as it takes, right? So as many attachment ruptures as there are, is how long this conversation is going to take, right? How many sessions it's going to take, because we really want to make sure that the family is now practicing skills to be able to use as life goes on, right? Just, once this maybe crisis is over, doesn't mean that life is going to get any easier, but maybe the skills and tools and resources that the family and individuals have are going to be stronger, right? That toolbox is going to have more resources to pull from. And so this is a really powerful opportunity for families to be able to practice those skills, right? So I will say, sometimes this doesn't go well, right? Like sometimes an adolescent will get dysregulated, or the parent will kind of stare and not know what to say. They don't want to mess up. And so that's maybe where the therapist has to be a little bit more active. Hey, mom, why don't you ask this question? Or if an adolescent or parent escalates, that's where we back up and we go back to our task 2s and 3s, right? That's the flexibility here of ABFT, is that we really are tuned into the family and making sure everyone has the new skills and resources to be able to have these moments for connection, these moments to repair the attachment rupture. Promoting autonomy. So this is where we are really talking about when the adolescent and young adult, right? This is where parents are asking, oh, well, what about friends? Or what about the struggles that we've had, some of those behaviors? So this is where we can talk about those things. This is where the family is able to discuss past challenges or past fears in a really thoughtful, reinvigorated way. So maybe let's say one of the topics was friends, and parents are really worried about a friend group, right? Instead of saying like, well, we really don't want you hanging out with Timmy and Johnny anymore, right? Like we think they're a bad influence on you. Because what's an adolescent going to say, right? Oh, well, it's not them. They're not the bad influence. Like I'm the bad influence, right? That closes down conversation and is accusation. It's criticism rather than curiosity. So what can a parent ask in those moments when we're trying to promote autonomy? I know that those friends are really important to you. Can you help me to understand the value of those friendships? What do they provide you that maybe I don't understand, right? Really being able to engage in critical conversations in a curious way, but not with that criticism, right? The desire to maintain connection, because we've just gone through all of those task force, right? We've just gone through all of those opportunities of reattachment, of reinstilling that secure attachment. So now we're really trying to show up. We're trying to say, okay, we can have these conversations without it escalating, right? We want to empower the adolescent and young adult, to empower the parents to really be able to rebuild that connection, and that if and when struggle happens, they can handle it as a family system. So it's really about, again, how to do that. I will say, sometimes in the promoting autonomy sessions, you will have a conversation that goes a little off the rails. Like maybe they're talking about social media, or maybe you're talking about school or something like that. And you really notice that everyone is getting escalated. This is a moment when you're going to take the family, take a pause, and this is probably when we have to go back to do task 2 and task 3, right? Those individual sessions to understand what happened. Because if something really becomes heightened in a task 5, there's typically an attachment rupture that was not tended to in task 4. Right? And so again, that's that flexibility and the hope that families don't get discouraged, right? That they're in this process. It's like, okay, let's go back, right? Let's understand those attachment wounds. Let's understand those attachment ruptures. Talk about it, so then we can talk about social media, or we can talk about school in a way that everyone is really able to collaborate. Okay, so those are the 5 tasks of ABFT. And so I want to just kind of briefly review them again, because that was a lot of information. But I want you to just think about, okay, when we are coming at this framework of that parents matter, family engagement matters, that we want to empower families to really tackle mental health struggles collaboratively, this is meant to empower them, right? The attachment matters, their attachment theory that we were talking about earlier. So attachment-based family therapy really tries to invigorate that. So we have task 1, which is the emotional reframe. Is the relational reframe. And so this is really getting the family to shift that perspective from behaviors, right? It's not a behavioral component. We really want them to focus on emotion and collaboratively working on their connection to one another. Task 2 and task 3 are the adolescent alliance and the parental alliance separately, right? We're really trying to give the adolescent or young adult some new skills to understand their attachment story, to understand that attachment narrative, their mental health narrative, how it all fits together, and to give them voice to bring up those attachment ruptures, right? And that they do so in a regulated and thoughtful and respectful manner. That task 3, we're preparing the parents. We're understanding some of their history. We're getting to know how they are, who they are. We're activating that caregiver instinct. So when their loved one comes to them and says, here are all the missed opportunities, mom and dad or caregiver, that they can show up, not become defensive. They have new skills and that curiosity. Because task 4 is when we're doing that, right? We're repairing attachment rupture. We're having concrete moments, episodic memories for them to address, to discuss, and increase understanding with compassion. The parents are saying, I am a safe place. We can have difficult and emotionally focused conversations in a way that will not lend to further disconnection, right? And then promoting autonomy is where we're talking about some of those prickly topics that may come up so that we're able to really collaboratively plan for what happens next. How do we discuss safety? How do we discuss risky behaviors, right? How do we encourage autonomy with the reasonable and balanced support of parents or caregivers, right? So this is the ABFT process and how we really aim to help families to heal those underlying attachment wounds and become really stronger and more connected altogether. I do want to take a moment here to talk about how we have integrated attachment-based family therapy into Newport Healthcare. And then I want to share a bit with you further about our larger model and why attachment is really something that we believe helps all adolescents, young adults, and families heal and work together. So we've just gone over ABFT. We've been fortunate enough to partner with the ABFT founders, and we continue to work with them for supervisions and trainings and really integrate ABFT into a residential treatment setting. We have all of our clinicians are trained in attachment-based family therapy. So this is anyone who is seeing a family, anyone who is also serving an individual is going to have attachment-based family therapy training, because we, again, really believe those underlying root causes matter. Our therapists are going through biweekly trainings and biweekly supervision, and we have opportunity for growth because we're so invested in ABFT as an organization. I want to just briefly touch on our values and how this tends to, how we serve the families and how we serve our clients, because we really want to be cognizant that when families are reaching out for help, right? If you have loved ones, family members, coworkers, colleagues, friends that are coming to you, we want you to be able to say, okay, there are so many resources out there, and here is one that is really about being an innovator in mental health treatment, that we are prioritizing our clients and families, our staff, to make sure that we are doing something that will help heal, that is about sustainable healing and long-term recovery for our clients and for our families. And something I just really briefly want to mention when we're thinking about our values is love, because that's really different, right? That's probably a different one because there's boundaries around that. But really, our belief as an organization and what we try to instill in our families is how we love, right, until they love themselves. And here's the other thing, right? If love was enough, there would be no mental health issues. There would be no stress or worries in the world. And so that's why we have all the other components to consider when we are treating families, right? When we want to be thinking about how to care for them. So with that, when we're thinking about the treatment model, we also want to see the whole person. So I mentioned before, ABFT is really about seeing the whole family system. Newport Healthcare integrates that into our entire treatment model, that we want to see the whole person. So we want to be considering, okay, so what are some of those risky behaviors? Sure. But what are the underlying traumas? What are some of the chaos that has gone on? What are those internal core beliefs that an adolescent or young adult has about themselves that feeds into some of their mental health struggles, right? And how all of this is about integrated care, that we have therapists and psychiatrists and teachers, we have experiential therapies, right? That we really want to make sure that the whole person is tended to, between yoga or mixed martial arts or equine therapy, adventure therapy, right? We want to see that whole person, and that the treatment team is really tuned in to making sure that all facets of the adolescent, young adult, and family are really tended to. Because as I mentioned before, the world that we're in, the struggles that we're seeing day to day, it's a community, it's a family, it's a systemic issue. And so we want to make sure that families are not just, just call me when everything's fixed, right? We want them to be involved in the process, provide them with support groups, provide them with psychoeducational opportunities so that everybody has the higher chance for sustainable healing. I do want to briefly mention, because I know that I talked about it a little bit through the ABFT presentation, but I also want to talk about what are different levels of care, right? So we have residential, which is 24/7 monitoring continual care in a facility with staffing, 24/7 nursing, and access to clinical support 24/7. So these adolescents and young adults are really struggling to maintain health and wellness in their daily life. Maybe they have been to therapy for a long time, or maybe they had a suicidal gesture that landed them in the hospital and they need to step down before coming home. So these are those opportunities. So it's 24/7. We also have PHP, which stands for partial hospitalization or intensive outpatient. Now, it's not hospital. These are all when clients are living at home, but they have a structured program. So for the PHP, for that partial hospitalization, it's a day-long program, but they're going home at night. They have family therapy, group therapies, individual therapies. IOP, the intensive outpatient, is when it's a couple of hours. Maybe they're still going to work or they're still going to school, and then they're engaging in therapy afterwards. And outpatient is kind of what you'd think of that typical once a week therapy or once a week family therapy, maybe a therapy group, something like that. And so I really just want to kind of note that there are so many different levels of care that are able to respond to the different levels of crisis that a family or individual is going through. When we think about that treatment approach that I talked about before, I also wanted to give you just a little bit of information about the different roles. So we have individual therapy, which again is really helping an adolescent or young adult work on those disempowering core beliefs, that they are talking about their trauma, they're talking about their depression or their anxiety. We also have counseling services, which tends to take a look at how the adolescent or young adult takes up space in the world. So what are some of those behavioral considerations that we do want to take a look at, right? How everything really melds together. We have so many different opportunities for healing in groups. I mentioned a few of those experientials before. And so we really want to make sure that we know that what works for one client may not, be the perfect fit for another. We as people all relate to that. And we want to make sure that our clients and that anyone who is trying to access healing has a variety of options to be able to do so, right? I mentioned again before that family involvement is truly mandatory, or we really want to make sure that families see that. We mentioned before, and you guys would probably know so many families or clients or peers that you're working with that are saying, we are struggling too. Yes, my loved one, or yes, my child, or yes, my niece is struggling, but we don't know what to do either. We want to make sure that no family feels isolated or alone. So we have the support groups, those psychoeducational presentations, and something that's really special about Newport is that we also offer alumni resources. So as you move through treatment potentially with Newport Healthcare, it doesn't just end when the adolescent leaves or the young adult leaves treatment, right? We really want to garner those connections moving forward. I do briefly want to you're thinking like, oh, this sounds great, right? Like, this sounds lovely. If families can show up, if they can take accountability, if they can be present, if they can really check into that, that would be lovely. What about some of the challenges? One thing is that if you have someone that is providing family therapy, an organization who really prioritizes family engagement, We know that this is going to be a roller coaster, and that's so natural. There's so much fear that can go into engaging in treatment, even if, right, even if everyone knows change has to happen, it can be really overwhelming, right? Everything I just talked about in ABFT means that a family has to take stock of themselves, that they really have to look at their own experience to then be able to make change happen. It's overwhelming, right? We are asking them to be vulnerable with people they're just meeting. So we know that. And we also approach all of that with empathy, warmth, and care, that compassion, that connection we were talking about a little bit earlier. But here are some of the challenges that you may be thinking about. And it's absolutely reasonable to be thinking about those as well, right? Feeling disconnected, especially if they're in a residential level of care, that discomfort of having to take a look at themselves. We talked again at the beginning and then throughout this presentation, family therapy is not about guilt or shame, yet so many parents and caregivers can't help to do that. I always challenge parents to say, like, that shame is not going to be productive, right? Like, accountability, that can be productive. To be able to say, yes, I showed up in a way that was not helpful. I am ready. I have new skills. I have new tools. So these are just some of the roller coaster elements that a family may go through while they are engaging in treatment. I do want to share with you a couple of other elements. So we talked about family therapy, we've talked about family engagement, we've talked about treatment models and really how to see a whole person. But I also want to provide with just some skills and tools that we really consider to be helpful for any of us, helpful for me to have reminders for myself, helpful for you in your relationships, but also how it helps guide the larger picture of family engagement and how to empower families throughout healing. So communication, we've been talking this whole time about attachment, connection, right? Part of this is also effective communication. So many times we have adolescents and young adults be like, well, my family doesn't listen to me, right? So we do know that sometimes that's, well, you're not maybe getting what you want, right? There's sometimes that shift that happens there. But the other side of that is, then how can a family member validate? How can they feel heard and feel understood? So active listening is going to be a huge part of that. We are in a world of so many distractions. And so really making sure that you are paying attention, that you're tuning in and being honest if you can, right? So many times maybe someone is coming to talk to you about something and you are trying to finish that email, or you have two phones, right? I know I have a work phone and a personal phone, and we can get distracted. Sometimes we have to be honest. It's like, I really want to hear what you have to say. Let me finish this work email, right? We want to be cognizant of our body. We want to be really aware of those nonverbal cues that we're giving, right? Are we rolling our eyes, or are we sitting, yeah, tell me about your day. That's fine, right? How are we engaging? The other component of this is to just be thoughtful of how we take up space. The other half of that, so if you're aware of your body language, then we're thinking about validation. Validation does not mean agreement. So when I was just mentioning before, adolescents feeling like they're not heard, how can we validate their emotional need, right? Validation does not mean, or if an adolescent says, I really want to go to that party, validation does not mean, okay, you can go to that party. Validation is, I can hear that this is really important to you. I can't help but wonder if you go to this party, it's going to put at risk all the work that you've done to improve your mental health, right? You're validating their emotion. You're not agreeing. You're engaging in reflection and conversation, right? You're not shutting it down. So open communication, effective communication, and conflict resolution is really a huge part as we're working on that communication and connection. The other part of this, right, we talked a little bit before about in task 3, when the parents have to show up and use new skills, giving them new skills and tools so that parents or adolescents and young adults can see that they're not alone on this journey. This is where we've got to show up, right? Modeling behavior and expectations, realizing that no matter like how old the adolescent or young adult may be, they're going to take those cues from their parents, which is why we have that involvement so much. So we really want to be considerate of how the parents are showing up, to not be venting their emotions, to show their ability to regulate, to not get caught up in certain expectations, and to make sure that parents are really, pardon me, are able to set consistent boundaries and structure and routine. So this is going to take some collaboration, and this is also done in task 5, but we really, again, want to reinvigorate the ability to do that. Pardon me. So as we end here and thinking about how do we empower families, how do we think about family engagement, and why does ABFT really so powerful? It's because it gets to that root. It gets to the root of the attachment ruptures, that matters, right? We talked about wanting to make sure that we're not caught up in a frenzy, that we're not just thinking about the behaviors here, because those are going to keep happening if we don't understand the root. And we truly believe that if families are able to have more emotionally focused conversations, then to develop that deeper connection and to open up the dialogue, then they can have conversations about their mental health, about their struggles, about their stressors in a way that is open and in a way that really lends to collaborative healing, right? That parents can validate, that adolescents, young adults see that families can change, parents can interact in a different way, that we really want to, again, reinvigorate this accountability for everybody in a family system. Right? I said earlier, family therapy is equal opportunity hot seat. This is really that moment, saying we are all here, we're all present, we're all going to engage as a whole family in a really different way. We hope that ABFT also just empowers everybody to know that change and healing continues to be possible. So I really appreciate everybody for joining me here today. I know we may have a couple of questions, so I'd be happy to answer those as well. Here's some contact information. If you have someone, a loved one, or again, a colleague or coworker, anyone that's coming to you that is hoping for healing, please just don't hesitate to reach out and know that it's possible. Thank you so much.
Sam, thank you so much. I have learned so much, and I wish that my family had ABFT when I was a child. And I love the key points that you have touched: compassion, love, community, and family involvement. And they are so dear. And you hit everything, every point was just awesome. And I do have a couple of questions for
Great.
you. With everything that Newport, and I thank Newport for doing this, it's so important to be compassionate to children. There's a lot of struggles, and I ask you this, with all the struggles that children have, being drug addiction, being thin, social media, there's a lot of trauma, divorce. Have you seen a spike after COVID?
Yes, we certainly have seen a spike after COVID and all of those and all mental health struggles. To be honest, I think our world really was just in crisis and then expected to go back to normal life. And particularly for teens and adolescents, they missed out on a number of years of really critical social emotional learning, right? We know results in academics, those have great impact, and the social emotional component. So then they're being thrust back into this world where those stressors, those social components can be terribly overwhelming. And it's not just adolescents, like you mentioned, the families, maybe if they're going through a divorce, or we certainly know that COVID had a whole host of employment and financial stressors, and that certainly ripples into a family system. So part of this is just acknowledging that, right? Acknowledging that we're all human and saying, okay, we need help. We need to be able to access resources, and that it's a sign of strength to ask for help, right? Not a sign of weakness.
Hmm. Absolutely. Can you share with us, with your knowledge and your experience, is there a family that you have worked with that has had a long-term success that you can share with us?
Oh, well, this is actually perfect timing and such a good question because I just last week got an email from a family whose young person, their daughter, is celebrating 6 years of sobriety. And it is from self harm and from substances. And the family really sticks out to me in particular because the family, the parents, had a lot of their own stuff. And so, I like to, and the ABFT kind of lends to this soft confrontational approach to be like, if you're expecting your child to grow and change, you have to also. So there were many difficult conversations, particularly with that dad and his own substance use and his own personal history, to say like, if you can take a look, if you can take accountability at yourself and have difficult conversations, this will be so empowering for your child. And to just hear that they all took this as an opportunity and she's been able to sustain this, it's always very exciting. And so that was perfect timing.
Well, that's great. And piggybacking to your answer, so what happens after you work with a family? How do they continue recovering? Do they do you still keep in touch with them? Can you elaborate on that?
Certainly. So while I may not continue to do family therapy, something that's really special about Newport are our alumni resources. And so we are able to have families provide them with support groups, to provide the families and the adolescent with a number of support groups. But we also, as part of our process, we help families find what comes next. Right? We help them through the discharge process figure out, okay, you're leaving Newport. What kind of therapy are you doing next? So we were able to really make sure that that doesn't stop. Right? There's going to be a whole host of challenges, particularly if they're in the residential and then they're going home. We want them to have the support to navigate that transition. So we certainly want to stay connected as part of Newport, and I always love getting those email updates or pictures of our clients just to hear how they're doing for sure.
That's great. And there's some parents out there that feel that we all feel that we're doing a good job at times, but how would you engage some of the resistant parents that there are issues
Yeah.
and just want to just fix my kid?
Yeah, absolutely.
How do you handle
Yeah.
that?
Part of that is really appealing to their love and to their care for their child. If particularly if they're taking, if they're sending their child to residential or even to a full day of therapeutic programming, they have to care about their kid and want change and want growth. And to really appeal to that caregiver instinct, right? That's all about what ABFT tends to do is to activate that. And sometimes it is having really difficult conversations and really exploring what is that resistance? What is that fear? Like, what are they afraid is going to happen if they show vulnerability? Right. So if we have parents or reticent caregivers, it usually is from their own fear of vulnerability and their own fear of having those difficult conversations. But I will say, we don't just like take no for an answer, right? So if a parent says, "Oh, like I don't want to be involved," um, we want we're going to engage that family, right? Because the truth is, particularly with an adolescent, they matter. If they're going home and if they're living with that parent or they're having visitation with their parent, that connection matters. And sometimes we know that we have to really reinvigorate that love and that connection. And we, as the clinicians, have to hold that hope for the family and say, like, you've got to, like you matter, you've got to show up. And so many families, again, it's maybe coming from a helpless component, but we want to really hold that space for hope and not, just let them kind of back out. Yeah.
So I had one other thing I wanted to add. I'm Shannon Roselle. I work with Newport Healthcare with our insurance contracts and with tribal heads, a lot with IHS specifically. And one kind of an exception I'm gonna add to this, Samantha, is when we have we just had 2 tribal members admit last week to one of our locations that is a campus setting. So they're able to put the sisters in separate pods because typically you don't admit family members to the same place. But with a campus setting versus a house setting, we're able to do that. And in this particular case, there will be no parental engagement because of CPS issues. So we're working with their IHS counselor person to identify a family member or a foster member who can fill that component eventually. But what they're doing is while the sisters they're 14 and 15 in age, they're in separate pods. They're bringing them together once a week for their family session because they will be each other's support while they kind of just really understand really all that is going on. These
Yeah,
girls have had so much trauma they don't even know that they've
right.
had trauma. It's really that deep. So we are able to work with those types of situations when a parent just is unable legally or ethically to be a part of the ABFT.
Certainly. And that's where though attachment will continue like be the underscore of what we're doing, right? The attachment perspective, even if it's not with that caregiver, we're still going to really help the adolescents, in that situation, understand how that has impacted them and to really help them work through those attachment ruptures, even when
Right.
their parents or caregivers are not able to be present. And I'm so glad, that we are opening that up to find a trusted adult that may be able to collaborate with them too.
Right. They have, great support within the counselors within the IHS. But
Awesome.
then in their tribal community, they will identify
Very cool.
foster them.
Thank you, Shannon. Samantha and Shannon, I can't even tell you. I thank you for the selfless work that you do. It's inspiring. And I couldn't thank you from the bottom of the heart for everything that you are doing. Now, if our members wanted to get more information on your presentation, Sam, can they just email you?
Absolutely.
Okay, fantastic.
Yeah,
Well,
our contact information was on that last slide, so that'll be on the library, and then I can help field any questions there as well.
Sure.
excellent. Well, thank you so much, Sam, Shannon. Thank you so much for your time today. And to our Nahara membership, thank you so much for joining us today.
Thank
Thank you.
you.
Thank you.
Take care.